Hello, everyone, and welcome to Behind the OR, the Peter Surgical Podcast channel, where we invite experts to reveal to us what's happening behind the closed doors of the operating room. Together, we will explore surgeries and procedures and discover more about a surgeon's life in their daily mission. Take off your gloves, take a breath, and let's talk behind the OR.
The role of minimally invasive surgery in the current era of cardiac surgery. Good morning, everyone. My name is Gianluca TORREGROSSA. I'm a cardiac surgeon from Lankenau Heart Institute in Philadelphia, United States. I have a deep passion for coronary bypass grafting, mitral valve disease, and I perform minimally invasive in the form of robotic bypass surgery and robotic mitral valve surgery. Minimally invasive surgery has been a phenomenon, an event, traditions that has been performed since the mid-90s. It was meant to try to minimize the burden of cardiac surgery that was conventionally performed via an open sternotomy, the front access that has been for years and still is the most used route to access the heart and perform surgery. Sternotomy is a safe way to perform complex procedure, but comes with the burden of a procedure that definitely takes time to heal from, has a meaningful impact for patients, their physical and mental ability to go back to their normal life after this surgery. Moreover, this invasive procedure has clearly in mitral valve disease, for example, delayed the presentation of patients to the operating room. We have evidence that surgery in mitral valve should be performed not when symptoms comes, but rather when echocardiographic evidence are present that the heart is start to suffer from the presence of this leaking valve. But it's very hard to convince a patient who has no symptoms, he's a young individual, to go to sleep and waking up with a long incision in the front portion of his chest and his major and one of his longest bone being cut in half to access the heart and receive a mitral valve repair for his valve. Robotic and minimally invasive procedure belongs to the same sphere. The strategy that surgeons have invented and have perfected to perform a less invasive surgery, improve patients' quality of life after surgery, and have more patients that can come to surgery in an early stage of their own disease, with offering better outcomes for their long term. In this sense, minimally invasive is on the form of thoracotomy or endoscopic or a robotic surgery. All of these strategies are not in competition to each other, but rather they are complementing themselves as different strategy with whom surgeon can perform mitral valve repair and replacement, coronary artery bypass grafting, treatment for atrial fibrillation, aortic valve surgery, and even in selected cases and in selected patients, ascending aorta replacement. So there is a huge push from patients and referring cardiologists in adopting minimally invasive strategies that do not compromise the outcomes, the quality of the valve surgery or the bypass grafting performed by the surgeon. But there is a need to offer this procedure to make sure that patients have a faster recovery in their life after this surgery. They have less risk of blood transfusion. They have a same quality of surgery, but they are then capable of going back to their normal life within just few weeks from the surgery. Minimally invasive is an attitude that requires not only the surgical strategies to be perfect, very well executed, with a highly technical skills team, but also require the interest of the anesthesiologist, intensivist, and everyone who is part and participate in the post-op care of these patients to jump on board and make sure that the progression of these patients is tight and all devoted to a final going back to normal life. That is the ultimate goal of every surgeon. Gianluca TORREGROSSA, and I'm happy to thank you for your attention, and I'm happy to take any type of question that you have after this focus on minimally invasive surgery in cardiac surgery. Thank you.
Let's meet at EX 2024 in Lisbon on the booth 230 to discover more about surgery, education, and innovation.